12 heart attack signs in women to never ignore. A heart attack happens when blood flow to the heart is blocked. Like males, females often experience chest pain or tightness. However, they may feel pain in other body parts. Women are less likely to survive a heart attack than men. This may be because the symptoms differ between the sexes. Women are more likely to have a silent heart attack or display unusual symptoms. In addition, female biology creates unique risk factors for heart attack, as some diseases that increase risk, such as polycystic ovary syndrome, PCOS, are not present in male biology. In today's video, we will delve deeper into the 12 symptoms of heart attack in women that you need to be aware of to protect your heart from danger. Also, stick to the end of the video, where we will highlight why heart attack symptoms differ in men and women. But before we start, first understand why heart attack symptoms differ in women and men. Heart attack symptoms differ between men and women due to a combination of biological, physiological, and possibly social factors. 1. Biological differences. Women's hearts and blood vessels are generally smaller than men's, and the process of atherosclerosis, the buildup of plaque in the arteries, may affect them differently. This may lead to symptoms that are less typical than the classic heart attack symptoms often seen in men. 2. Hormonal influences. Estrogen, which has a protective effect on the inner layer of artery walls, helping to keep blood vessels flexible, decreases after menopause. This loss may potentially alter the nature of heart attack symptom. 3. Differences in pain perception. Women may experience pain differently than men, including a greater sensitivity to pain or different interpretations of pain signals. 4. Coexisting conditions. Women often have heart attacks later in life compared to men and might have other health conditions like diabetes, hypertension, or metabolic syndrome, which may mask or alter heart attack symptoms. 5. Psychosocial factors. Women might attribute their symptoms to stress or anxiety rather than a physical health issue, potentially delaying seeking treatment. Now, let's find out the symptoms of a heart attack. 1. Chest pain or discomfort. Chest pain, or discomfort in women before a heart attack, often termed angina, is primarily due to the reduction of blood flow to the heart muscle. Atherosclerosis, a condition where plaque accumulates in the coronary arteries, is typically the cause of this decreased flow. When these arteries, which supply the heart with oxygen-rich blood, become narrowed or blocked, the heart struggles to receive the oxygen it requires, especially during moments of increased demand like physical activity or emotional stress. In a study of 515 women aged 29 to 97, researchers found that about 30% of the women reported chest discomfort before their heart attack. In women, the presentation of chest pain may be more subtle than in men. Instead of the classic crushing chest pain, women might experience a squeezing sensation, pressure, or discomfort in the chest. This difference may be due to variations in the way atherosclerosis develops in women, often affecting not only the main coronary arteries but also the smaller blood vessels that branch out from them, a condition referred to as microvascular coronary disease. 2. Pain in arms, back, neck, or jaw. Women may experience pain in the arms, back, neck, or jaw as a precursor to a heart attack due to the complex way in which the body transmits pain signals. This phenomenon, known as referred pain, occurs because the heart and these other body parts share a common nerve supply from the spinal cord. During a heart attack, the heart muscle is deprived of oxygen due to blocked blood vessels. At that time, the brain might interpret the heart's distress signals as coming not just from the chest, but also from the arms, back, neck, or jaw. This misinterpretation happens because the brain is less adept at pinpointing the source of pain when it comes from internal organs, leading to a diffuse pain sensation that may manifest in areas other than the chest. A 2018 study looked at 532 people who had an ST elevation myocardial infarction, a type of heart attack that affects the whole heart muscle wall. Shoulder pain was twice as common in females as in men. Throat and back pain were also more common in females. A daily consumption of a handful of nuts, about 1.5 ounces, may contribute to heart health. Moreover, replacing saturated fats with healthier fats found in olive oil may improve blood flow and reduce the risk of plaque buildup in the arteries. Do you find this information helpful? Don't forget to hit the subscribe button and ring the bell icon for more health secrets and tips. 3. Stomach pain. Stomach pain before a heart attack in women may often be misleading because it mimics symptoms of less severe conditions, such as indigestion or stomach ulcers. This type of discomfort, often described as abdominal pressure, fullness, or a squeezing sensation, occurs because of the heart's close communication with the digestive system through the autonomic nervous system. When the heart is under stress due to reduced blood flow from narrowed or blocked arteries, this distress may be reflected in the stomach. The autonomic nerves that innervate the heart also connect to the stomach and other parts of the digestive tract. Therefore, when there's a problem in the heart, the brain might interpret it as stomach discomfort due to the shared neural pathways. Fiber-rich foods such as whole grains, legumes, fruits and vegetables may improve digestive health and reduce blood cholesterol levels, contributing to better heart health. It's advisable to aim for at least 25 to 30 grams of fiber per day, spread out across meals. 4. Shortness of breath, nausea, or lightheadedness. Shortness of breath, nausea, or lightheadedness in women before a heart attack are symptoms that may arise due to the heart's inability to pump blood effectively. When the heart is deprived of oxygen-rich blood because of narrowed or blocked arteries, it struggles to perform its essential function of circulating blood throughout the body. This inefficiency may lead to a buildup of fluid in the lungs, known as pulmonary edema, causing shortness of breath or a feeling of being winded without exertion. In a study with around 1,300 women from different ethnicities who had suffered a myocardial infarction, about 63% experienced shortness of breath. Simultaneously, the reduced blood flow may affect the gastrointestinal system, leading to symptoms like nausea. The heart and the digestive system are closely linked through the autonomic nervous system, which controls involuntary bodily functions. When the heart is under stress, this may upset the normal functioning of the digestive system, manifesting as nausea or a sense of unease in the stomach. Furthermore, when the brain receives insufficient oxygen due to poor blood circulation, it may result in feelings of lightheadedness or dizziness. This is because the brain relies on a continuous supply of oxygenated blood to function properly. When this supply is compromised, cognitive functions may be temporarily impaired, leading to these symptoms. Foods that are high in omega-3 fatty acids, such as salmon, walnuts, and flax seeds, may help improve heart health by reducing inflammation and improving blood flow. It's beneficial to include at least 2 servings of fatty fish per week and a handful of nuts or a tablespoon of flaxseed daily to fulfill your body's omega-3 requirement. 5. Sweating. Approximately 35% of heart attacks in women are believed to go unnoticed or unreported. In women, not only is tightness or discomfort in the chest a warning sign, but in addition, perspiration is also one prominent symptom. In response to the reduced blood flow and oxygen, the body's sympathetic nervous system activates as part of the fight or flight response. This system triggers the release of adrenaline, a hormone that prepares the body to either face the danger or escape from it. One of the immediate effects of adrenaline is the stimulation of sweat glands, leading to sudden sweating. This sweating due to a heart attack is usually cold and occurs without any environmental or physical reasons to explain it. Incorporating foods rich in potassium and magnesium may be beneficial, as these minerals help maintain healthy heart function and blood pressure. Bananas, spinach, and avocados are excellent sources of potassium. Aiming for a daily intake of 2,600 to 3,400 milligrams of potassium is necessary. For magnesium, incorporating almonds, spinach, and black beans may help women reach the recommended daily intake of 310 to 320 milligrams. 6. Heartburn or belching. Women may experience heartburn or belching before a heart attack due to the heart's close anatomical relationship with the stomach and esophagus. As a result, even though the discomfort originates in the heart, it also affects parts of the body that share nerves, like the upper digestive tract. Moreover, during stressful conditions, including a heart attack, the body might produce excess stomach acid due to the surge in stress hormones, exacerbating heartburn symptoms. However, one study shows that the link between gastroesophageal reflux disease and coronary heart disease risk decreases with age. Minimizing the intake of spicy foods, caffeine, chocolate, and fatty foods may help prevent the onset of heartburn and contribute to a healthier heart. 7. Swelling. As the heart's pumping action becomes less efficient, blood may back up in the veins that return blood from the body to the heart. This backup increases pressure within the blood vessels, which forces fluid from the bloodstream into the surrounding tissues, causing them to swell. Additionally, as the heart's ability to pump blood diminishes, the kidneys may respond by retaining more salt and water to increase blood volume, which further exacerbates swelling, particularly in the legs, ankles, feet, or abdomen. It's recommended to limit sodium intake to less than 2,300 milligrams a day, and ideally aim for no more than 1,500 milligrams per day for most adults, especially those with high blood pressure. Additionally, eating diuretic foods like cucumbers, celery, and asparagus may help reduce water retention. 8. Unusual palpitations. It may be unsettling to experience unusual palpitations before a heart attack in women, which are characterized by feelings of the heart racing, fluttering, or skipping beats. When combined with other symptoms, these sensations, while occasionally benign, may be a sign of underlying heart problems. The mechanism behind these palpitations is typically related to disruptions in the heart's electrical system, which regulates the heart rate and rhythm. When the heart muscle is strained due to reduced blood flow from blocked or narrowed arteries, a precursor to a heart attack, it may respond erratically. This strain may interfere with the heart's electrical impulses, leading to irregular heartbeats or arrhythmias. The discomfort from a lack of oxygenated blood might not always manifest as pain. Instead, it might present as these abnormal palpitations. A study indicates that 62% of women experience palpitation before a heart attack, while only 59% of men show the same symptom. 9. Extreme weakness. Extreme weakness before a heart attack in women may often be a perplexing and alarming symptom. Heart function is negatively impacted when plaque accumulates in the coronary arteries, a medical condition called coronary artery disease. As the heart works harder to pump blood through these narrowed arteries, less oxygen reaches the body's tissues, including the muscles, which may lead to this sensation of extreme weakness. In a study of 76 women who had experienced a myocardial infarction in the previous year, 68 women experienced prodromal symptoms, including unusual fatigue. Foods high in antioxidants, such as berries, nuts, dark leafy greens, and whole grains, may help reduce inflammation and improve blood circulation. Aim for at least 5 servings of fruits and vegetables per day to ensure a sufficient intake of these vital nutrients. 10. Coughing or wheezing. Coughing or wheezing before a heart attack in women may be indicative of heart-related issues, particularly when these symptoms are not associated with a respiratory condition like asthma or chronic obstructive pulmonary disease. When the heart cannot pump blood efficiently, pressure may build up in the veins that carry blood from the lungs back to the heart. This increased pressure may cause fluid to leak into the lungs' air spaces, alveoli, a condition known as pulmonary edema. As the fluid accumulates in the lungs, it may lead to symptoms such as coughing and wheezing as the body attempts to clear the fluid from the airways. 11. Insomnia. This sleep disturbance is often linked to underlying heart issues that may not yet be apparent. When the heart doesn't supply enough oxygen-rich blood, it may lead to increased stress and anxiety levels, contributing to sleep disturbances like insomnia. Additionally, the body's attempt to compensate for the poor blood circulation may increase heart rate and blood pressure, making it harder to relax and fall asleep. This state of heightened alertness, especially at night, disrupts the natural sleep cycle. Furthermore, hormonal imbalances associated with heart disease risk, such as reduced estrogen levels in postmenopausal women, may also contribute to insomnia. Estrogen is known to have a protective effect on heart health, and its decline may exacerbate heart problems and disrupt sleep. The American Cancer Society found that sleeping 7 to 8 hours per night is associated with the lowest mortality rates, which are linked with cardiovascular disease and cancer. 12. Anxiety. In a study of 726 healthy men and women, researchers found that high, sustained levels of anxiety were independently linked to the accelerated progression of atherosclerosis over 4 years. Hence, if you are feeling anxious, it may also be a subtle symptom of a heart attack. When the heart's ability to pump blood is compromised, the body's fight or flight mechanism releases stress hormones like adrenaline, which may lead to feelings of anxiety, restlessness, or a sense of impending doom. The body is essentially signaling that something is wrong, even if the individual is not consciously aware of the heart's distress. B vitamins, particularly B6, B12, and folate, found in avocados, bananas, and lean meats, help regulate mood and stress levels. Remember, not all women experience all these symptoms, and some may experience none at all. The key is noticing unusual changes in your body and consulting with a healthcare provider promptly. Women often tend to downplay their symptoms, but it's crucial to take them seriously and seek medical attention immediately if you suspect a heart attack. Today, we learned about all the symptoms that you may experience before a heart attack. But did you know that there are other signs that your health might be at risk? Want to find out more? Watch 13 warning signs of vitamin B12 deficiency. Or watch 10 signs your body is begging for vitamin D. You may watch either or both of them. Do you know any other symptoms of a heart attack that were not mentioned earlier? Let us know in the comment section below.